Good afternoon, and thanks for joining us. This presentation, Support is Your Key to Successful CPAP Therapy, is brought to you by Sleep Disorders Australia. My name is Mark, and I'm the business owner of CPAP Sales, which was established back in 2009. And joining me today is Christina, a CPAP therapist and leader of our customer support team.
Hi everyone, we hope you find this presentation helpful.
We would like to thank Sleep Disorders Australia for arranging and hosting this event this evening. And just as a reminder, SDA is a charity organisation run by volunteers, so please consider joining SDA or at least making a donation to help them continue their important volunteer work. And before we begin, it is important to let you know that we're not doctors, so any decisions made as a result of this event should be acted on only after consulting with your doctor. We all need good sleep. It is an essential part of our lives. And for those using CPAP machines, support is vital to successful CPAP therapy. In this presentation, we're going to talk about the common problems new CPAP users experience and provide some tips on how to solve them. We'll show you the different types of masks and explain the pros and cons of each type. There's a lot of jargon in the CPAP industry, and we'll briefly explain the technology differences between CPAP, APAP and BPAP. We'll also go through the typical CPAP machine data and explain simply what that means. Please post your questions during the live stream, and to keep the flow going, we will save the questions until the end of the presentation. In the Q&A session at the end, we will answer as many questions as we can, and for those we don't get round to today, we will reply to you directly later. Typical problems and solutions will be answered in depth during the Q&A session. Now, it is tempting to jump right in at the beginning when you've got your new CPAP machine and sleep with it straight away. But my advice, practice first. Much like learning to drive a car, you'll need to learn how to use your CPAP machine. This includes getting used to the air pressure and the mask on your face. And honestly, CPAP therapy is a learned experience. It doesn't happen overnight for some people, so please practice first. So here's my suggestion on the practicing routine. On day one, I highly recommend, as I said before, not to try and sleep with your CPAP machine straight away. Just connect up your mask and your hose to the machine and then practice for 2 hours. Breathe in and out through your nose only, that's very important, with your mouth closed. Concentrate on doing that. Again, it's a learned experience, so there's no book on this, just practice breathing in and out through your nose, keep your mouth closed, watch TV, read a book. Don't try and sleep with it, just get used to the pressure. It might feel strange and uncomfortable at first, but that's normal. So that's what I'd recommend, 2 hours the first day. On the second day, more practice. Practice makes perfect, as they say. And if you're confident after that 4 hours of practice, then lead the second practice into your regular sleep time, and then you should really be able to go for it. Mask discomfort is the number one reason why patients give up on their CPAP therapy. Finding the right mask can involve a lot of trial and error. And there are 3 main styles. There is a nasal pillow, and a full face mask. And within these 3 styles, there are typically 3 different size cushions, small, medium and large. Sometimes there's even extra wide or extra small. Then there are 4 main manufacturers. We've got ResMed, Philips, Fisher & Paykel and BMC. Then each of these companies has got several new and old models to choose from. The choices can be daunting, even overwhelming, and there are a lot of pros and cons of the different types of masks. So in the following slides and information, we're going to provide you the basic outlines of the nasal pillow and the full face mask. We're going to explain what they are, we're going to explain the pros and cons, and do little videos just to show you what they look like and how they fit. The nasal pillow mask is the style that I use and I personally recommend. However, it seems that with this style of mask, the patients will either love them or hate them. There really isn't much in between. So again, practice is important, and the pillow mask can take some getting used to. The direct flow of the pressure into the nostrils where it seals takes a bit of getting used to, and especially breathing out through the airflow. But in my opinion, it really is worth the effort and perseverance, because overall they are lighter and much more comfortable. With this style of mask, you must breathe in and out through your nose and keep your mouth closed. If you can't do this, then go back to the beginning and practice, practice, practice. It really is worth the effort.
The nasal pillow style of mask is small and lightweight. It has thin straps with Velcro tabs to adjust the mask size. The headgear straps are elasticated, making it easy to put on and take off. Usually, medium pillows are fitted to the mask, with small and large pillows also included. If you find the medium pillows are not suitable, you can easily change to the larger or smaller pillows. All masks have an exhaust vent. The nasal pillow masks usually include a lightweight short hose, which connects to the longer hose of your CPAP machine. It is super easy to fit the mask. Simply insert the pillows into your nostrils and place the rear strap over the back of your head. Removing and reinserting the pillows from the nose gives the best seal inside the nostrils. The swivel elbow helps reposition the hose as you turn over during sleep. With this style, you must breathe in and out through your nose and keep your mouth closed.
In most cases, the nasal mask is a small triangle-shaped cushion that fits over the nose only. Air leaks can be a problem due to a poor fitting mask, and one of the number one reasons why you get an air leak is the cushion size is wrong. Now, cushion sizes are typically small, medium and large. Again, there can be different sizes like extra small or extra large, but generally small, medium and large. And unfortunately, there's no sizing guide between manufacturers. So like when you buy clothes, a small, medium or large, they're all different really, to be honest, and that's the same with the cushion manufacturers. So mask sizing guides are generally available, and some manufacturers, and this is my favourite, will include all the cushion sizes. These are sometimes referred to as a starter kit or a fit pack. Now that really helps because middle of the night you've got your new mask ready to go with it, and you think you've ordered a medium or you've been fitted for a medium at your sleep clinic, but really you should have been a large or a small, and then it's really frustrating. So if you've got a mask pack that's got the 3 sizes, you can be the master of your own destiny. 11 o'clock at night you can be fiddling around. It's not ideal, but you're not going to get any customer support at that time of night anyway, and there's nothing they can do over the phone or by email, so you've got to sort it out yourself. So if you've got 3 sizes of cushions, that really is your best chance for success. And remember, with a nasal mask, you must keep your mouth closed. Breathe in and out through your nose only.
The nasal style mask has elasticated headgear and Velcro tabs at the top and bottom to adjust the straps. The bottom straps include clips to hook onto the bottom of the mask. The small triangle-shaped cushion fits over the nose to create a seal. Cushions typically come in small, medium and large and can be easily replaced or swapped to a different size using the same frame. All masks have an exhaust vent and often include a swivel elbow to help reposition the hose as you turn over during sleep. Place the cushion over your nose and slide the straps over your head. With this mask, the headgear clips are a hook shape that fit over the bottom of the mask frame on either side. The cushion should fit comfortably over the nose and stay firmly in place as you move your head from side to side. With this style, you must breathe in and out through your nose and keep your mouth closed.
Full face masks are the go-to mask if the patients can't stop opening their mouth to breathe during the night, or they need high treatment pressures. Unfortunately, they are bigger and heavier than regular nasal or nasal pillow masks, and this puts a lot of patients off, especially when there's a lot of bulk in front of your face. It can make the patient feel a little claustrophobic. Also with a large surface area, because it's a big triangle shape that goes over the nose and the mouth, so there's more chance of the mask leaking. And patients will often over tighten and try to compensate for this, and sometimes a poorly fitting mask, the patients end up making their straps really tight to try and get a good seal, and it could be that the mask size is wrong. And so really a mask with 3 different nut size cushions again is probably the way to go. In my opinion, if you don't open your mouth to breathe during the day, you shouldn't really need to open your mouth at night to breathe. So my theory, and again it's my theory, I'm not a doctor, a lot of experience, but my theory only, is that patients that have lived with sleep apnea for many years before being diagnosed, and during this time they probably start off sleeping by breathing in and out through the nose, but as soon as they have an apnea event, you wake up, you gasp for air, you open your mouth, and then basically it's all over, red over. You end up breathing through your mouth all night because you need that volume of air. But with a CPAP machine and a nasal mask, you're going to get all the air that you need to breathe. You don't have to open your mouth. With practice, concentration and perseverance, I stress perseverance because you have to practice, you have to try, do your best. Try and retrain your brain if possible to breathe in and out through your nose only. Because if you can do that, then you'll have a lot more selections of masks.
This full face style mask has elasticated headgear and Velcro tabs at the top and bottom to adjust the straps to the correct size. The large triangle shaped cushion fits over the nose and mouth to create a seal. Cushions typically come in small, medium and large and can be easily replaced or swapped to a different size using the same frame. This mask has 2 exhaust vents. Place the cushion over your nose and mouth, then slide the straps over your head. With this mask, the headgear clips are a hook shape that fits over the bottom of the mask frame on either side. The cushion should fit comfortably over the nose and mouth, staying firmly in place as you move your head. The swivel elbow helps reposition the hose as you turn over during sleep. With full face masks, you can use your nose or mouth to breathe.
So mask fittings are highly recommended, but even then it really isn't a perfect science. Even though the sleep clinic staff may have many years of experience, sometimes a mask that fits well during a consultation can be a different story when the patient tries to sleep with it during the night. So I recommend, especially for new CPAP users, to have the different size cushions available to try in the comfort of your own home. Starter kits or fit packs can be a great option as they include the multiple cushion sizes. Next, we're going to provide an overview of the different CPAP therapy technologies. And reminder, if you have any mask questions, please post them and we'll do our best to cover them in the Q&A session at the end of this presentation. Acronyms can be really confusing, especially when there are so many similar terms, and one, which is CPAP, is often used as a default description. The last 3 letters, PAP, are all the same, and this means positive airway pressure. Simply, the treatment is delivered by a machine that sucks in room air, blows it back under pressure through a hose and the mask into your body. So CPAP, which is constant or continuous positive airway pressure, they're also known as fixed pressure machines. They're set to 1 treatment pressure. I emphasize 1 because there is just the 1 treatment pressure that these machines will deliver all through the night. And this is based on a doctor's prescription, and it's always, as I said, 1 number and typically between 4 and 20 centimeters of water. Some doctors prefer patients to be using constant fixed pressure devices, and this is based sometimes on the doctor's personal preference or for a genuine medical reason. But it is worth asking your doctor if an APAP or an auto machine will be suitable for you. Why APAP or why auto? APAP stands for Automatic Positive Airway Pressure. Also known as auto or auto CPAP machines, they'll adjust automatically the airflow during sleep between a minimum and a maximum pressure that's been preset for you. Auto machines are arguably more comfortable than the fixed pressure machines and are considered to be more future-proof. So why do I say more comfortable? Well, patients on a higher treatment pressure can enjoy the benefits of a lower pressure for the times when they're awake and in control of their own breathing. So the automatic machine doesn't need to deliver a higher pressure. It detects that the person is awake because they're breathing normally, and in that case the machine will just deliver the minimum pressure that's been set. And why do I say future-proof? As you age, your muscle tone weakens. This means that you might need a higher pressure in the future. During sleep, you'll need slightly more pressure when you're lying on your back than on your side. If you've had a few drinks, your pressure treatment might also change. So APAP or auto machines keep pace with these changes. APAP machines can also be set to a CPAP or a fixed pressure mode, so it's a lot more versatile. If your doctor has prescribed a fixed pressure machine, it still may be worth asking the question whether they'll write a script for an auto machine instead. More than 80% of our patients choose auto over CPAP. And why do patients choose an automatic machine rather than a fixed pressure? Well, as I mentioned before, more comfortable and future-proof, and that really is borne out by statistics. Bi-level positive airway pressure, or BPAP for short, have two different treatment pressures. One for when you breathe in, and often a much lower treatment pressure for when you breathe out. And this pressure difference is sometimes referred to as pressure support, and it's typically used for patients who have lung function issues such as COPD. So BPAP machines have a lot more additional parameters to be set up and can only be prescribed by a sleep physician. Going back to what COPD means, it's another acronym. This one is chronic obstructive pulmonary disease. COPD is an umbrella term for a group of patients that have progressive lung conditions, emphysema, chronic bronchitis, chronic asthma. The condition causes a narrowing of the bronchial tubes in the lungs, making it difficult to breathe. COPD is a progressive and currently incurable disease. Next, we're going to provide an overview on what your CPAP machine data means. But in the meantime, if you have any machine technology questions, please post them now, and again we'll do our best to cover as much as we can in the Q&A session at the end of this presentation. So what does my CPAP machine data mean? Well, the first part is compliance or usage, and this is a measure of how the patient has been using the machine. Now ideally at least 4 hours every night, or at least 4 hours a night for 70% of the time over the last month is the guideline or the requirement. And this doesn't mean sleep, but it does show an intent to comply with CPAP therapy and is often used by sleep specialists to gauge compliance. And this data might be used to support driver license renewals, especially for professional drivers. So it is important to use the machine as much as you can every night, and again at least for 4 hours a night. P90 or P95, what does that mean? Well, the machine is running at a treatment pressure through the night, and so P90 or P95 is the pressure that the machine's been running at or less for that particular percentage of time, so 90 or 95% of the time. It's often used to determine what the patient's treatment pressure should be if a fixed pressure CPAP machine is to be used. Okay, AHI, the Apnea-Hypopnea Index, so AHI, is an index of sleep apnea severity, combining the apneas and hypopneas. So an apnea simply means a pausing in breathing for greater than 10 seconds, and simply a hypopnea can be described as a shallow breathing lasting for more than 10 seconds. The AHI is calculated by dividing the total number of events by the number of hours used. AHI values are typically used to categorize the severity of patients with obstructive sleep apnea. 5 to 15 events per hour is considered to be mild, 16 to 30 events per hour is considered to be moderate, and over 30 events per hour is considered to be severe. And when using CPAP therapy, the AHI target is less than 5 apnea-hypopnea events per hour, and of course the lower the number the better. Some machine data also includes a figure for leaks. Now all masks have an intentional leak from the exhaust port, as you can see in the picture. The total mask leak should be under 24 to 30 litres per minute, and the lower the number the better. If there's an excessive mask leak, the ideal treatment pressure might not be achieved, and in extreme cases the mask leak can cause automatic machines to increase the pressure and maybe even reach a point where the machine switches off. So an intentional mask leak is a design feature of every mask so that the patient's carbon dioxide from the breathing can be expelled safely. Auto machines will try to compensate for leaks by automatically increasing the pressure to maintain an adequate treatment pressure. In some cases, this can be undesirable. For example, the pressure will be too strong and wake the patient up, or a stronger pressure actually forces the lips and mouth open. So if a patient is using a nasal or nasal pillow mask and then opens their mouth, then this will be considered to be an undesirable leak. Next, I'm going to give you some examples of common problems and solutions for new CPAP therapy users. In the meantime, if you have any machine data questions, please post them, and again we'll do our best to cover them in the Q&A session at the end of this presentation. Some common feedback we get from new patients is that they think the pressure is too strong or the machine is blowing a gale. Now, CPAP machines fixed pressure are set to a treatment pressure. This is prescribed by the doctor, and it is the pressure that your body needs to keep your airway open. This pressure is different for every patient. Usually practice before starting CPAP therapy will help immensely. If patients can't get used to the treatment pressure that's required, then a ramp or a lower starting pressure can be enabled. This will help patients receive a lower treatment pressure to begin with and will slowly increase over the ramp time. The ramp time is typically how long it takes the patient to fall asleep. But how long is a piece of string? A patient can fall asleep very quickly one night and it can take them quite a long time the next night. So it is a variable between 5 and 45 minutes for some machines and between 5 and 60 minutes for other machines, set in 5-minute increments. And this, I guess, is one of the issues with a fixed pressure machine. We are aiming to reach that treatment pressure at some point, and the ramp time will help to slowly build up the pressure. If the patient is still awake and the treatment pressure has been reached, and the patient thinks that treatment pressure is too strong, then usually it's a matter of pressing the ramp button to start the treatment pressure all over again at the lower starting point. But support is your key to successful CPAP therapy, and communication with your health provider, your CPAP equipment provider, your sleep clinic is vital. So don't hesitate to contact them. They're there to help you. Okay, here's another one. My teeth hurt or my nose hurts. Well, strangely, teeth pain can occur when using CPAP therapy. It does usually go away as you get used to the treatment pressure. And I think this is because when you're concentrating on keeping your mouth closed, you've got to put your tongue somewhere. It pushes against the roof of your mouth, but quite often your tongue can push against your teeth and put some pressure pushing them forward. But if pain persists, please consult your doctor. And in terms of nose pain, noses are sensitive and pain can occur on the bridge of the nose or underneath your nose. This can be because the straps are too tight or the mask size is incorrect. So in these cases, it's a matter of perseverance and consulting again with your CPAP equipment provider to get some help and support. Chest pain could be as a result of the lungs working harder to breathe out against the airflow coming in. Now, exhalation pressure relief, or Reslex, Aflex, C-Flex, EasyX Comfort, these are all different names, but essentially the same machine setting, and this can significantly help. Pressure relief reduces the airflow when the machine detects that you're breathing out and lowers the incoming pressure accordingly. Typically settings are 0 to 3, 0 being off, and the higher the number, the easier it will be to breathe out. And this setting can be very helpful for patients using nasal pillow masks. So consult with your support team for advice, and remember again, support is your key to successful CPAP therapy. Just one point really, if you do have these chest pains, of course consult your doctor for advice, especially if you're concerned that it could be heart related. Opening the mouth during sleep can be a common problem, and as explained earlier, practicing can help solve this, but not always. Some patients will even resort to taping their lips closed. If you can't keep your mouth closed during sleep, basically there are two options. Use a chin strap in conjunction with a nasal or nasal pillow mask, or use a full face mask. Now if you wake up with a dry mouth, the same can be said as I mentioned before, that the mouth is being opened during sleep. Also, you could try increasing the humidifier heater setting to add more moisture to the airflow. If you need help with adjusting your heated humidifier, have a look at your owner's manual first. If you can't find the details there, feel free to contact your equipment provider. That's what they're there for. They're there to support you. CPAP masks can be uncomfortable. Everyone is different. We're all individuals with different levels of patience and tolerance, and finding the right mask can involve a lot of trial and error. I think I mentioned before that there are many different styles of masks, different sizes. Manufacturers have got different sizes, different makes and models between those brands. But don't give up, please. You will find a suitable mask. It may involve some trial and error, but at the end of the day, you have to sleep with your CPAP machine every night, and so it really is important to get your mask right. There are a large number of reasons why masks leak. A common one, of course, is that the headgear straps are not tight enough, and the headgear does wear out. Remember, you're using it for ideally 8 hours a night, and that soon turns out into hundreds, if not thousands of hours. Again, the mask cushion can be too old, and silicone does lose flexibility over time. A common one is that the cushion size is incorrect, usually too big. Facial hair can interfere with the seal, and mask styles can be incompatible with some facial features, so you might have to try different brands of mask to find the right one that's going to suit you. A common issue is that the pillow pushes the mask away from the face. You can imagine, especially with a full face mask, it's a large bulky area pushing against the pillow. That can break the seal, so there are some solutions for that. You could try using a CPAP pillow, which is a specially designed memory foam pillow that has divots on the left and the right hand side, so that when you roll over, you're facing left or right, the mask falls into the divot area, so it's not pushing away from your face so much. Masks can be reassembled incorrectly after cleaning, so that can be a common reason why some masks start to leak when they didn't before. And another issue is sometimes that the hose pulls the mask away from the face when you're turning over. But don't give up. You will find the right solution, and you've got to sleep with the mask and the machine every night, so just don't give up. Sleep clinics might be closed due to COVID-19. It's understandable that sleep clinics have to stop patient visits due to this highly contagious respiratory virus. So be patient. We hope obviously this is not going to last forever. So if they're closed, you might have to have some other options for support, and usually that's remote support. So sleep reports can be emailed to you. You may be able to retrieve the data file from your SD or USB stick and email it to your support team, and then they can email back your sleep therapy report. Or your machine may already be reporting automatically the data to a cloud storage area for remote reporting anyway. And for mask fitting, equipment providers may have temporarily stopped mask fittings, again due to the coronavirus. So masks with multiple cushion sizes are a good option during this time. Well, we've now come to the end of our presentation, and it's time now for the Q&A session. So please feel free to ask all the questions that you'd like to have answered, and we'll do our best to get through them. If we can't answer them all by the end of this presentation, I think we're due to wrap up at 6:15, and then we'll reply by the SDA Facebook page. So I think the first question is from Mark, and Mark mentions that he gets discomfort as though he's swallowing air, and takes maybe an hour in the morning to get rid of that discomfort. Well, Mark, I think that is not a very common effect, but it does happen that you are swallowing air. It could be that the mask that you're using doesn't have some good exhaust vents to expel the air, or obviously if you're swallowing the air, then maybe the pressure on your machine is too much. I think really if it is becoming a point where you are getting too much discomfort and you can't get any relief from that, then definitely see your doctor. Any more questions at the moment? Christina, can you tell me if there's got any more questions?
Mm-hmm. Yeah, sure thing. A question that we commonly get is in regards to stopping water accumulating in the hose. That is quite common at this time of the year. It is due to the humidifier adding moisture to the air and compounding with the natural moisture in the air. There's a couple of things that you can do to resolve this or to lessen the impact. Definitely insulating the hose, either via a hose cover or a heated hose. Generally that will assist. You can also do things like ensuring that the machine is lower than your head when you're laying in bed. Just to, gravity will assist in that instance. Also, you can put less water in the tank itself and, of course, decrease the humidifier setting. So those are some very common solutions to a common issue that a lot of us find occurring, particularly in the cooler months of the year. So that's something that I think would help quite a few people. Mark, any further questions?
And there's no more questions on Facebook at the moment, so we've gone through those. Have you got any more questions that you've got there from other people?
Another common issue that some people may find is just discomfort from the mask in general. So pressure sores, things like that can occur when you've got something quite tight fitting to the face, on a consistent basis. Again, this is sometimes common, generally more so if the mask is ill-fitted or too tight. So ensuring that the straps are firm but not uncomfortable is an easy solution. You can always look at comfort covers, so a barrier between the silicone of the mask and the skin is another way to relieve some of the discomfort, and quite common, unfortunately, but something that we're all have some solutions to. So that's an option. Mark?
Yes, okay. Another question. Again from Mark, and this question is ozone safe for cleaning? And the question really goes to the point of what ozone is. I mean, ozone is basically, it is oxygen with an extra molecule added, and it's definitely not safe to breathe. So when you're using ozone cleaning, the recommendation is to leave the room while that ozone cleaning is in process. Ozone is a very common cleaning method for a number of products, not just CPAP equipment, but there are ozone cleaners for swimming pools where you're actually sanitizing the water. So ozone cleaning, is effective, but the point is that it can be toxic, or it is toxic to breathe, and so you must exit the room when you're running through the cleaning process. Hope that answers your question, Mark. Okay, I'm not sure whether we've got any more questions at the moment. It looks like no, we don't. So we're ready to wrap up, I guess, if there's no more questions. No. Okay, I think it's now time to finish this part of the section. And basically the last thing really I'd like to say is please visit the survey page that we've got coming up now. So the survey page is really for us to gauge how this presentation went, what you thought about it, and if you'd like another one, what kind of what kind of questions would you like us to answer, and what kind of topic would you like us to focus on for the next presentation. So please visit cpapsales.com.au/SDA survey, all one word. So that's cpapsales.com.au/SDA survey. That will take you to a very, very quick questionnaire. And then, as I say, we can collate those and see what kind of topic we can do for another presentation. Thank you and good evening, and I hope you enjoy the next presentation.